Hi guys, today's video on that I'm gonna make today is on step 2 CS, how to prepare for USMLE step 2 clinical skills exam. Most of you would have taken the step 2 CK, which is the step 2 clinical knowledge exam already. So you will be bubbling with knowledge. So it is advised that it's better to take the step 2 CS as close to step 2 CK because your knowledge is fresh. For IMGs, it is very important to plan ahead. Because the sooner you plan, the better would it be for you, because then you could be in US, because this exam is conducted in US. You can be here in a timely manner. So trying to take the step 2 CK locally, and then when you are applying for step 2 CK, also apply for step 2 CS at least not more than 2 weeks or at the most 4 weeks after the step to CK, so that you are ready with your knowledge, and you have to just go through this exam and your knowledge would be fresh. You don't have to restudy for this exam. The first and most important tip for this exam is your optimism in your ability and staying confident that you can do it. Your confidence will make you successful. You already have studied all the subjects and you are booming with confidence. So you have to express that confidence in your personality. The better, the more confidence you have, the better are you going to perform on this test. The second thing is, good manners. The good manners actually express your personality. The better your manners will be during the clinical cases, the better would it reflect your personality. And those simulated patients would realize that you have got a good habits, you have good manners. So always take permission before doing anything, and always say thank you after you have done something, and be very nice, have a nice big smile on your face, and you should be genuinely concerned about the patient's complaints, and that will show that you are a good physician and you are not just acting. The second thing is that you have to be very specific with your time management. The time flies away, but the good thing is that you are the pilot of this time. So the better you will manage this time, the better would be during your case management exam. And your productivity will also improve with your time management. And try to focus on the job at hand. Like I said earlier, try to schedule this exam early. The fee for this exam is $1,580, which may change, and the time to increase the allocation or the space, or if you want to take it on a later date, is $80. So that is very important. The books which are recommended, there are a lot of books available. There are cases online which are available. I'll put the link for the cases which you will be tested on. There are various books to prepare. Crush Step 2 CS is a good book which will have all the common cases and how to take history taking, clinical exam, formulating your differential diagnosis, and writing your notes will be in this book. And try to schedule on a testing center which is convenient for you. If you are local, then try to schedule it at a testing center which is close to you. On the test day, make sure that you are really crisp in your personality. You're dressed well, are wearing a clean white shirt with a tie, or any shirt for that matter, have nicely pressed trouser, polished shoes. You have taken a shower that day, and girls could also dress decently as well. Try not to wear a very strong odor perfume, because that will distract the patient and yourself as well. Try to be on time. Make sure that you have a clean white coat, and it should not have any logos or the names of your medical school, so that you stay anonymous. And make sure that you have a stethoscope of your own, so that you don't start looking for a white coat or stethoscope at the testing center. They can provide that to you, but you don't want to get it theirs. You have your own tools, because you will be more comfortable if you have a hammer to do the reflexes. That would be nice. And make sure you are freshly shaven. If you shave regularly, make sure you have a good shave that exam. And always be positive during this exam, and stay familiar with the list of cases that I will attach the link at the end of this presentation, and practice those cases with your friends, colleagues. You can make your friend as a simulated patient, and then you can have different cases picked up, say abdominal pain, and then you can go in and see your friend who could be your simulated patient, and practice, so that all these things become a second nature to you, so that you don't forget them. Because if it becomes like your muscle memory, then you will not forget those things, like washing hands, being courteous, being nice, saying thank you, shaking hand. All these things count towards your ultimate score. So this exam, as we go over the exam, it has got 12 simulated patients which have to be examined in 15 minutes. And after that, you have 10 minutes for the note. So about 35 minutes per patient, and every patient is important. There will be 5 cases in the beginning, then you have a break, 4 cases and a break, and then there are 3 more cases. So 35 minutes per patient, and then at the end of that, you will write your notes. So the things that you would be evaluated would be on integrated clinical encounter, in which that will include your data gathering skills. You have asked the relevant questions, and then you record them and then write them in your note. Then it is the communication and interpersonal skills, how well you were communicating, how well you were asking those questions, and how were you dealing with the patient will be included. And then last is the spoken English proficiency, how proficient you are in your spoken English, so that simulated patient will record that as well. And you have to pass in all 3 subjects, in all 3 capacities, to be deemed successful. So like I said, that there will be 15 minutes per encounter. So before you go in, you have to read the case. It will give you a brief description. Say the patient has abdominal pain. They may give you some lab values. And then you have to go in and start the encounter. And before you go in, you wash your hands or apply hand sanitizer on your hands. And while you are going in, making sure the patient sees that you had hand sanitizer, dry it, and then you can handshake with your patient, so that you don't transmit anything to your patient. That would be very vital, and the warmly you meet your patient, the better it would be. So time management, like I said, is very important. So your history should be focused on the chief complaint. If there is abdominal exam, you make sure you ask the relevant abdominal pain, you ask the relevant questions, then do a focused physical exam, and your line of thinking should be appropriate. And you can divide this time of 15 minutes into quadrants, like 4 4 4, and then 3 minutes. So you can spend 4 minutes for your history taking, 4 minutes on the past medical history, PAM, hugs, FOSS. Then you can also give 4 minutes to your general exam as well as the physical exam and the closure, in which you will explain things to your patient, that what are you thinking in terms of the diagnosis and what are you gonna do to relieve the pain and the complaints of the patient. So that would be an easy way of doing this exam. So make sure that you always knock at the door, you're smiling at your patient, you shake hand, and whatever you are doing, make sure do show empathy to the patient, and you are sympathetic to your patient as well. And you can sit down during your history taking. Always ask the permission, can I sit down during my history taking? If the patient says yes, then you can do that. And always ask patient, try to have a good eye contact, develop a rapport with the patient, and always keep on asking, okay, tell me more about your complaint, so that they feel that you're really concerned about patient's complaint. And also, the more you will practice, the more you will know what are your 4 minutes of history taking, when should it end, and try to be focused. So like I said in the beginning, the time management will make you successful in this exam. The time flies, but you are the pilot. Remember that you are the pilot of this time. So if you manage it well, you have practiced the exam well, you will know how much is 4 minutes for your history taking. And during the history taking, regarding the specific complaint, always go over the review of systems. Ask from head to toe all the systems which are involved, from head, eyes, ENT, exam, neck complaints, cardiovascular, respiratory, abdominal, neurological, musculoskeletal, psychiatric, general overall well-beingness. So all those questions have to be asked in a timely manner. In terms of your past medical history, remember the mnemonic PAM, hugs, FOSS, the past history, allergies, medications, previous hospitalizations, urinary problems, gut and sleep issues, family history, OBGYN if it's a female patient, social and sexual histories. So all those would be included. In terms of the physical exam, make sure that your physical exam is thorough. You have a general look at the patient, whether the patient looks comfortable, is in agony, how is the face of the patient, and then from head to toe, general exam is really useful in terms of the looking at the head, any rashes, any prominence of the eyes and the neck. You can look at the goiter, any dysmorphic features, any fast breathing that you're noticing, the patient is in agony with pain, or a specific posture in the body, that will all, pedal edema, that will all be covered, and you can just glance through these things in about 30 seconds so that you can have more time for focused physical exam. Say his abdominal exam, you have to make sure you start with the site of pain opposite. If it's right lower quadrant pain, start from the left side. Make sure you palpate the liver, the spleen, Make sure you do the test for appendicitis, rebound tenderness, guarding, make sure Rovsing's test, obturator test, all those tests for appendicitis, make sure you perform them if it is a suspected case of appendicitis. And then always when you examine, make sure about the you take the consent for the drapes. You make sure if there is a sheet below the belt, or there's a gown, you raise or ask the family to raise the gown to a comfortable level so that you can look at the abdomen. And when you're examining chest, you have to open the gown from the top and make sure you ask them to pull it down to the comfortable level, and then ask them to pull it up again, and then you can tie the knot if you want to. And same is with the drapes on the abdomen exam, or if there is genital exam that needs to be done, then has to be done with permission as well. And during all this time, make sure you're smiling, you have eye contact, and continue to maintain good rapport with the patient. In terms of the closure, once you're done with the physical exam, you don't just leave. You counsel the patient, you reassure the patient that although you have abdominal pain, I'm worried about appendicitis, I'm worried about intestinal perforation, we will give you pain medicine, we will give you fluids to hydrate, we will do ultrasound or a CT scan for your complaint, and we'll make sure that you will stay comfortable. We'll take care of you. We have a good team of physicians, will help as a team to relieve your health problem and complaint. So those closing things are very important, and most important thing is reassurance. You reassure your patient that you are in safe hands. You will take care of your patient, show your ownership to your patient, and be very sympathetic to your patient, and make sure that your patient understand all this thing. And make sure before you leave, you shake the hand again, show gratitude, thank the patient for letting you examine, and tell them that you will take care of them. And this will happen only when you will keep on practicing. The more you practice, the better you will get at it. And like I said, simulated patients could be your friend. You can ask your friend to be your simulated patient, and you can practice on each other and do exam for each system again and again and again, so that all these things that we have discussed so far become your second nature. You have to make sure that the confidence that you have on your abilities, and that confidence is on your competence, because you have worked hard for this exam, you've worked hard for step 2 CK, you have the clinical knowledge, and the more confident and self-belief you will have, the better you will perform at it. So it is, you are acting your test, but that acting has to be genuine. You have to be genuinely worried about your patient. Then once you're done with this part, you go out, write your note, and your note will have a structure. You have to make sure a good structured note, which will have a detailed account of whatever you have discovered. In HPI, make sure you are explaining all the complaints, say abdominal pain, in terms of symptoms, in terms of the location of the pain, and all the things that we do for abdominal pain. You have to make sure you have to tell the location, intensity on a scale of 8 to 10. What is the quality? Is it a colicky pain? The onset, when did it start? Radiation of the pain, say it was started in the umbilical area, where did it go? Is it worsening? Is it progressing? What is the duration of the pain? When did it start? The frequency, is it a chronic pain or intermittent pain? Is it what is the setting? Where did it start? Does it increase on walking? Does it decrease on rest? Any alleviating or aggravating factors? Any associated symptoms like vomiting with the pain? So this mnemonic of LIQ, ORP, DFCS, and AAA you can use during your HPI. And your HPI should be like a story, should have flow in it, so that the reader can understand whatever you are trying to explain. And in the review of systems, make sure you have covered everything from head to toe. Quick leading question: no headaches, no problem with the vision, hearing, taste, smell, no throat pain, no neck pain, no cardiac issues, no complaints of palpitations, difficulty in breathing, abdominal pain, sexual function. You have covered that. Make sure you have this musculoskeletal pains. So all those things will be covered up in the review of systems. And the past medical history, we have already discussed the mnemonic that you will use to cover the past medical and other histories. Then the physical exam, you will make sure document the pertinent positives. Other than the general, make sure you highlight your positive things: rebound tenderness, guarding, or decreased reflexes, palpitations, or thyromegaly on a patient with weakness, that there was a thyroid which was palpable. And then you have to put down your differential diagnosis. You just need to say with abdominal pain, right lower quadrant appendicitis, or peritonitis, renal colic. And then you have to define that, okay, the patient had pain in right lower quadrant. You have to substantiate your diagnosis. There was positive rebound tenderness and guarding in that area, or positive McBurney's test sign, or the patient had right renal colic, or patient had arthritis, swelling of the joint, redness of the joint because it was a septic arthritis. All those things that you will substantiate, and there will be, should be nice and easy to figure out, and easy to read for the reader, so that you are your note is self-explanatory in what you are trying to do. If you have bullet points, make sure that you don't put too many bullet points, because then you will be running out of space. So try to use one bullet point for 2 or 3 or up to 4 exam findings, or the HPI findings, if you have to put them in. And in terms of all those things that we have discussed, make sure your differential diagnosis is clear and succinct, so that you are focused on your chief complaint, and you substantiate whatever you have done. The diagnosis is the closest to the patient's complaints. And workup, make sure the relevant workup that you think is needed should be listed. Like I said earlier, if it is abdominal pain, you want to do an ultrasound, CT scan. If you want to do the blood work, patient was vomiting, BMP, or chem panel, you're worried about the hepatitis, liver function test, you're worried about some bleeding, make sure you do the CBC, make sure the child, the patient has adequate testing done. So your diagnostic studies should support your differential diagnosis. So these will happen only when you are practicing again and again. The most important things, in a summary, is that you should be very genuinely looking. You have good, make sure you are well dressed. Your personality is pleasing to the patient. You are warm when you come in. Make sure you build the rapport, good eye contact, shake the hand. And always thank you the patient on everything that the patient does for you. If you ask the patient to lift up the gown to the comfortable level on the abdomen, make sure you thank and ask them to pull it down. And all this time you have to maintain a good eye contact, because that will indicate that you're really worried about the patient, and that will really you will develop an association with your patient, which will be good in terms of your assessment and in your success at this exam. If you have to sanitize your hands multiple times, don't hesitate. And when you are going to re-sanitize your hand, don't just stop talking, keep on asking patient, and you have any other concerns, can I help you with anything else? So there are no blank times during these conversation. And make sure whatever mnemonics you are using, use them carefully. Don't repeat the questions, because then the patient would see, okay, what's going on? You have asked about my diet and you are asking again, or you asked about my sexual activity, you're asking again, you asked about my allergies, you are asking again. So those things are not right, will not go well. So if you use mnemonic, make sure you use your mnemonics in the right order. And draping is very important. You should not embarrass your patient. Don't overexpose or don't underexpose your patient, so that you can properly examine your patient. And when you ask them to move their gown, ask them respectfully, can you please lift your gown? I want to check your abdomen. Can you please open your gown? I want to listen to your chest, or I want to listen to your back. Explain whatever you are doing. Before doing any step, make sure you tell your patient whatever you want to do. And make sure you do a good closure, and at the end of the test you shake the hand of your simulated patient, and then you walk out. So these, and when you document, there should be a flow to your documentation: good HPI, review of systems, physical exam, differential diagnosis, and then the recommended investigations. That will complete your exam. So remember, there are several exams. If you feel you didn't do well in one case, just shut it off. Don't think about it again. Go to the next case and restart positively on the next exam. And then each case, like I said, there are several cases. You should always be focused on each case at that specific moment, and you make sure that each case gets the right attention. Don't show signs of being tiredness. Stay happy in all the tests. Make sure you have a big smile on your face. That big smile on your face goes a long way. That will make your patient happy and reassured as well, that my physician is relaxed, confident, and happy, and show genuine concern for their complaints until the last case is done. And that will be the end of your exam, and then you can go home, take rest, and enjoy for a few days. I hope all this presentation was helpful to you all. Please like this presentation, share with your friends, and subscribe to my channel. May God help you all to clear this exam. Thank you and best of luck. Sallallahu alaihi wa alihi wa sahbihi wa sallam. Thank you very much. Thanks all.